Hi, I'm Olivia, and our presentation is on common pregnancy ailments and their solutions. We're section 7, and like I said, I'm Olivia, and we have Charlotte, Mom, AK, Mary, Ryan, Kara, and Zakia. So I'm going to talk about the first trimester, a couple of those ailments. The first one we're going to talk about is nausea and vomiting. The ailment is, of course, nausea and vomiting, and it occurs pretty commonly in pregnant women. It started around the first trimester, around the first missed menstrual period, and usually ends by the fourth missed menstrual period. The exact cause is unknown, but it could be because of the elevation of beta HCG, which is usually present in the body when morning sickness begins. Hyperemesis gravidarum is often severe nausea and vomiting, and if you're puking more than once a day, you need to make sure that you're contacting your provider so you don't get an imbalance of electrolytes. The solution is that nurses need to assess the onset, frequency, and duration, making sure that, again, they're not vomiting too much and losing those electrolytes. Avoiding certain odors of food. I'm sure you've all heard about the pregnant lady being like, oh, that stinks, and then vomiting right after, or eating a food and then vomiting right after. So making sure you're avoiding those foods is also a solution. Making sure you're getting up slowly and not quickly rising can also help prevent nausea due to hypotensive episodes. And making sure you're eating small meals, drinking your liquids, getting those electrolytes back. And then another interesting fact is that ginger, acupressure, and other alternative therapies have been seen to be helpful as well. And again, making sure you're contacting your provider if you're vomiting more than once in a day, showing signs of dehydration, or having signs of electrolyte imbalances. Fatigue and breast tenderness. So fatigue is common in early pregnancy. It's mostly because a woman has to get up a lot at night to pee. She's got a baby growing inside her. Usually this resolves towards the end of the first trimester. A solution for this could be just taking a nap, making sure you're getting your rest, using every opportunity to lay down and put your feet up and take a break is always good. And it will subside, and the partner should understand this as well. Sometimes the husband can be very conflicted, why isn't my wife making me dinner or helping out around the house as much as she used to? He just really needs to be understanding at this point. Also, you're going to get breast tenderness. Increased levels of estrogen and progesterone can increase the soreness and tingling felt in breasts. It also increases the sensitivity of the nipples as well. A solution, just find yourself a good fitting bra, making sure you're spending the money and getting the proper support. This is kind of the best relief for that. And then you're going to have an increased vaginal discharge as well, known as leukorrhea. This is a result of hyperplasia of the vaginal mucosa and the increase of mucus by your vagina as well. The increased acidity of secretions can encourage the growth of fungus, but it also decreases the growth of bacteria. So it's kind of a win-lose situation there. The solution for this, cleanliness is key, making sure you're bathing daily. You don't want to douche during pregnancy because that can cause pregnancy complications. Avoiding nylon underpants and pantyhose because this is going to retain all that heat and moisture and increase the chances of infection. And making sure that you wear cotton underpants, this can actually absorb some of that leukorrhea as well. And then again, report any vaginal discharge, irritation, or intense vaginal itching to your provider as well.
Okay, so the next ailment we're going to talk about is nasal stuffiness, epistaxis, and botulism. So a ailment is nasal stuffiness. So that's when estrogen levels can produce edema in the nasal mucosa. And so nasal stuffiness, nasal discharge, and obstruction, and then also possible nosebleeds, which is epistaxis. A solution for this can be cool air vaporizers and normal saline nose drops, and then also medicated nasal sprays and decongestants to solve that problem. And then the other ailment, botulism, is really rare. There's not much research because a cause has not been established, but that's when excessive and often bitter saliva in the back of your throat is produced. So they say a good solution for that is mouthwashes, chewing gum, sucking on hard candy, maybe carry a tissue or a towel to absorb that excess saliva. And then the next one is the urge to urinate, which is very common. It also happens in the third trimester. And this is caused because of the baby growing, and the pressure is placed right above the bladder. It's very common. There's no need to really tell your healthcare provider about it unless you are having pain or a burning sensation or presence of blood in the urine. So nothing is really recommended for the issue other than encouraging the woman to go to the bathroom often, and keeping your environment free of having a safe pathway to go to the bathroom when needed.
Okay, so some elements that women do experience in the second and third trimesters, backache. So 70% of women experience lower backache. You might have heard of lordosis. It's also called swayback. It's the curvature of the lower lumbar region of the spine increases as the uterus becomes heavier. Steroid hormones that are increased during pregnancy do contribute to the problem because they do soften and relax the pelvic joints. So some solutions would be pelvic tilt can help restore proper body alignment. Interior pelvis is tilted upward, the curvature of the back is automatically decreased at that point. So use of good body mechanics can reduce the strain that is felt in the lower back, and also maternity support belts. Well, the evidence doesn't really support the effectiveness of this, but it's worth a try. And this is some of the pelvic tilt exercises for pregnancy, for lower back pain. Another alignment that women do experience in the second and third trimesters is heartburn, regurgitation of acidic gastric contents into the esophagus. So about four-fifths of women experience heartburn, result of the displacement of the stomach by enlarging the uterus. Increase in progesterone decreases gastric motility. It does relax esophageal sphincter, leading to heartburn. So some solutions would be avoid fatty fried foods and overeating. Don't lay down as soon as you eat. Drink 8 to 10 8-ounce glasses every day. Eat small, frequent meals. Liquid forms of low sodium antacids help as well. Aluminum may cause constipation. Magnesium can cause diarrhea. Sodium bicarbonate, like baking soda and Alka-Seltzer, because they may lead to electrolyte imbalance.
Hemorrhoids are varicosities of veins in the lower end of the rectum and anus. They can cause itching, swelling, pain, and bleeding. They can be internal and external. They're caused by the uterus pressing on the veins in the rectum, which can cause issues with the circulation of the blood. Constipation caused by pregnancy can also trigger them, and labor. A solution is to gently and carefully reinsert them if they are on the outside, using knee to chest position, and you can lubricate your fingers and push them back inside. Try to avoid being constipated. You can use like Colace, stuff like that. Ice packs, topical ointments, warm soaks, just to relieve the pain and itching. Contact the healthcare provider. If they're hard, they can be surgically removed if needed. Ankle edema, or swelling of the ankles, which is something pregnant women often complain about, is difficulty of venous return in the lower extremities. It's an issue when accompanied with hypertension, mainly. Warm weather and long periods of standing can aggravate it. A solution would be to elevate your legs and hips, avoid long periods of standing and being in warm weather, and to frequently dorsiflex your feet.
Good morning. So the next ailment that we're going to talk about is constipation. And while this can affect anybody in any stage of life, it's especially important to consider during pregnancy because of the peristalsis in the bowels slowing down. In addition, the hormones involved with pregnancy not only slow it down, but can also make it more difficult because you need more iron in pregnancy, and that can also cause more constipation, and there's a little bit of displacement of your intestines due to fetal growth. So what your provider might recommend that you do is that you increase your fluid intake, that you do some daily exercise, that you use a dietary fiber, or a pharmacological method such as a stool softener, laxative, something like that. But in general, we do like to try to avoid pharmacological measures if we can, because this is such a common ailment. And again, this goes right in hand with the flatulence. Again, when you have the decrease of peristalsis in the bowels, you can have delayed gastric emptying, which causes the flatulence. So you want to start by avoiding foods that you know are going to make you experience gas. And you're going to have to make sure that you try to exercise and keep yourself reasonably regular, so that even though that the gastric emptying is delayed, it's not so severe.
So another ailment with pregnancy in the second and third trimesters that's relatively common is leg cramps. These are painful muscle spasms in the gastro and the semus muscles that most frequently occur at night, and they're caused by the forward extension of the legs when you're sleeping. Solution for this is much like that picture shown right above, is your partner can extend your knee down and bend your foot towards your leg, and that can provide immediate relief. Massages and warm packs are also effective, and then also as a preventative measure, stretching before bedtime reduces the chances of these leg cramps happening. Another problem is varicose veins. Maybe a lot of you have seen these before, but they're mainly caused by poor circulation in the lower extremities of pregnant women, and it's caused by a weakening of the vessel wall. Also, the weight of the baby in the uterus prevents venous return. Symptoms can range from the mild cosmetic effects to chronic pain and thrombophlebitis. Solution for this is regular exercise, just being on your feet, trying to promote that venous return. Avoid standing in one spot for a prolonged period of time. Also, again, as our picture shows above there, sitting with your feet and your hips elevated, but also being mindful to keep a pillow under your back to prevent compression of the vena cava. Some people also use compression stockings. Also, another problem with pregnancy in the second and third trimesters is shortness of breath. This is caused by the uterus rising into the abdomen, and it puts pressure on the diaphragm. It causes your respirations to become shallow. Women do not feel relief until lightening occurs and the baby moves down into the pelvic cavity. Solution for this could be sitting upright in a chair, using proper posture, making sure that your spine is as straight as it can possibly be. If shortness of breath occurs at night, the woman can prop herself up with pillows behind her shoulders and neck.
Okay, so one of the common issues that women also face in the second and third trimester includes faintness, and this is faintness, which is caused by blood pooling in the woman's lower extremities, and this causes postural hypotension. So if the woman is moving from a sitting position to a, she moves from a lying position to a sitting position, or from a sitting position to a standing position, she might feel faint because her blood isn't circulating the way it normally does, and so her blood pressure isn't adjusted as well. They tend to feel faint also in warm and crowded areas after they move positions suddenly. The best way to make sure that they don't have issues with faintness is to ensure that they have proper patient education on the symptoms so that they're able to recognize it before it becomes an issue for them. If she's feeling faint, she should know that she can put her head between her knees. And if that isn't effective for her, she should be able to lie down to get fresh air. If she's getting up from a lying position, she also should know that changing positions slowly can help her decrease feeling faint. And then difficulty sleeping is also very common with women who are pregnant, and it typically starts at around 12 weeks and beyond. These include whether she's falling asleep or whether she's waking up during the night. And physical factors are some of the main contributors to this issue, such as having an enlarged uterus. It often makes it very difficult to find a comfortable position for the woman to sleep in. And if the fetus is very active, this can also make the problem worse for her. Urinary frequency, leg cramps, and shortness of breath can also cause this discomfort and are sometimes lead causes. So difficulty sleeping is sometimes caused by other symptoms that a woman is experiencing during her pregnancy. So the best way that she can, a nurse can assist a pregnant patient is by assessing their sleep habits. They want to provide information on activities and techniques that can help promote restful sleep for the pregnant woman, which could include drinking a warm, non-caffeinated beverage before going to bed, having the woman's partner give her a soothing back rub, or even a family member can help her fall asleep better. There are pillows that can help support the patient's back, and there are specific pillows that can be put under her upper arms or between her legs that can also help a woman while she's sleeping on her side, which is sometimes more comfortable for a lot of women. Sleeping medications, stimulating activity, and caffeine products are things that a woman would want to avoid while she's pregnant. They don't actually promote better sleep for her at this time.
And then there's restless leg syndrome, which is a condition that we characterize by an irresistible urge to move the legs. It usually happens at night. It can also include itching and similar sensations to tingling. This occurs when the patient tries to fall asleep. A solution for this could be treating it based on the cause, because there can be many factors that contributes to this. You can have iron deficiency, which you would treat by using iron supplements. It could be caused by having a very sedentary lifestyle. So during the day, you might want to incorporate some moderate intensity, low impact exercises. And if severe enough, the provider may prescribe carbidopa or levodopa for bedtime. Another ailment, believe it or not, is carpal tunnel syndrome. This can be caused by nerve compression, which is due to the fact that the blood volume doubles during pregnancy. This causes swelling in the blood vessels. So this can actually compress the median nerve, and this can happen on both sides of the body, so both wrists. It can be worsened by constant hand movements, such as typing or texting frequently. A good solution for this, as much as possible, is if you can get the client to perform less of these movements, split the hand. Surgery and steroids are usually recommended in severe cases of carpal tunnel syndrome, but of course we don't want to recommend this for pregnant women. So if you can do more, if you can use less medical intervention, it would be better. And then for our last slide, this is an image that our professor actually brought up to us. It's actually, it's a really great picture because it sort of sums up everything that we talked about today. And it's just really easy to visualize. You'll see, if you read closely, you'll see that a lot of the things we said are mentioned right in here, and it even has some more things. Thank you so much for your time.